good morning. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, creator and founder of Balance and Fall Support Group in Aging Adults and Physigen PT and Wellness. So every Thursday, we highlight innovators, educators, academicians, and amazing, we even have audiologists at one point globally. So for tonight, wherever you are, if you're in Philippines, good evening. And of course, if you're in America, good morning. So we have an amazing academicians, professionals that we highlight for this morning. We have a physiatrist. So I'm a physical therapist, and we need to know for our different colleagues and caregivers what are physiatrists, right? And we have Dr. Kirill Alekseyev for tonight. He is a medical doctor and Master of Business Art Administration. He's a physiatrist as well. So he's a medical director, senior medical director right now of the Post-Acute Medical PAM Rehab Hospital of Dover. And of course, he has a wide variety of experience as well. So he has been featured and also one of the leading physicians featured in Delaware and awarded for that. He is team physician for professional hockey at one point in Delaware Thunder last 2019, from 2019, and he is still actively a member of the New York Society of Physical Medical Rehab, of course, a medical also here in Delaware for the Medical Society of Physiatrists as well, and of course the Medical Society overall. And he based in New York, Brooklyn, and that's where he did his residency. So even he's doing his residency, he's busy doing some symposiums, and one of his specialization is concussion. He featured it in different, I think, retired NFL players at one point, right, Dr. Alekseyev, and of course, clinicians like us. So I would like to pick up his brain about what is his practice all about. And we are working as well. I'm part of his organization, but I'm based in different area in Delaware, a little bit south. And it's my opportunity to talk to him. He's managing the 40 of the PAM hospital. I thought only us, only the Delaware part. Imagine those 40 different. So without further ado, welcome, Dr. Alekseyev. How are you?
Good, good, good. How are you? Thank you for having me.
It's amazing. It's nice to meet you. My pleasure. So knowing that you have, what's your passion? Why physiatry? That's the first thing. Why physical medical rehab?
So physiatry, it's like it's like a broad spectrum of so many different, areas, kind of incorporated. I mean, if you look at physiatry, it's not very well known in some areas, but more popular in some more developed areas like New York, California. PM&R has been around for a long time, right? So, and what is physical medicine rehab? It's really, the way I look at it is, it's really like a hospitalist or internal medicine doctor who oversees rehab patients, right? So when patients come to acute rehab for a variety of reasons, whether it's stroke, brain injury, Parkinson's, or post-op. What we do is we manage them on the floor. We take care of them. We make sure they're not only medically stable, but they're functionally improving. We guide the therapy, physical, occupational, speech therapy, and we try to get them back to baseline. So if they had an event like a stroke, we try to bring them back to where they were before this event has occurred, and get them as functional as possible so they could go back to the community and be a functional member of the community. The great thing about physiatry is you could do a lot of things with it. You could do pulmonary rehab, you could do cardiac rehab, sports medicine, brain injuries. You could go into cancer rehab, general rehab, pain. I mean, there's so many different variations and different subspecialties that, you could really be developing your own practice and your own little niche and the things that you actually enjoy doing. And that's what I like about it. We, technically under the umbrella of PM&R, we are musculoskeletal specialists. But then once you go in further and subspecialize, like for example, I'm double board certified in PM&R, but also brain injury medicine. So that makes me a specialist in brain as well.
Okay. Yeah, just like us in physical therapy, we have subspecialties. So I'm more on geriatrics and neuro. And now we have also subclassification. All right. So with your experience, Dr. Alexeyev, with NFL players, concussion. So we have listeners here for the balance and fall support group. When they heard concussion, is it just the same as the dizziness, or what are those symptoms? Like how we can categorize that this person is having a concussion, trauma or not?
Sure. And then, concussions is usually viewed in, athletes, right? I mean, that's where everybody's known concussions from.
Mhm.
It's a brain injury, it's a mild brain injury, under the category from an event that maybe occurred during tackling or whatever the case is, or in soccer, hitting, your head when you're, heading the ball, or collisions. There's so many different ways, but that's the basic way of looking at it. That's the athletes. But we also forget about the aging population, right? The aging populations, when they have a fall,
Mhm.
um, they are just as prone to these concussions. We have to keep in mind, brain is, it's a free structure in the skull, right? It's not attached to anything. So when you fall and you hit an area, let's say in your frontal lobe, the brain actually hits and then it bounces back, and you have a countercool injury. So you have a countercool injury with concussions. So it's almost like a double injury occurring. Unfortunately, for the aging populations, those concussions are more severe. You could get a brain bleed possibly as well. Because the brain is so fragile, the bridging veins are so fragile, so they could develop, like a subdural hematoma and things like that. But in terms of concussions, we're looking specific for concussions. The imaging is not really necessary for it, but what we look for is symptoms. What are some of those symptoms of concussion? It's dizziness, it's balance, it's headaches, it's blurry vision, right? It's inability to tolerate light and noise, and it's just really difficulty with sleep day to day. And let's say you were working full time, it's difficult for those individuals to go back to work and resume their activities because of all these symptoms kind of occurring. They need to have frequent adjustments, breaks, and also treatment in order to get back to norm. And as we know that a lot of concussions do improve over time on their own as well, therapy does speed that up. Speeds up the recovery. It speeds up the reaction time, the speed. Speech could help with memory techniques, which we utilize them for, or either recovering memory or new forming memory techniques. So I think therapy is very, very important in terms of recovery for concussions.
Yeah, it's a team effort, right? So that's
Yeah.
really, really very important. And we really appreciate your presence as well as a physiatrist. That's really important. A guidance, and then, of course, more clarification of this is what's happening for our patients as well. So what's your most, if you can share, Dr. Alexeyev, if you can share one of your most challenging case at one point as a physiatrist, and what did you manage and after that?
So, I mean, challenging cases, when, I was dealing with Delaware Thunder, it's a minor league pro hockey team. The biggest challenge when you're dealing with athletes per se is, when they get a concussion, they want to go back to play. So the reason I put these symposiums together and work with the former retired NFL players and all the doctors that are team physicians and drive the different adjustments and protocols and things like that. The biggest challenge that we all kind of came to a conclusion is hiding symptoms. So these athletes, when they get a concussion, they usually like to hide them because they're afraid you're not going to let them back to play. And the same thing for individuals in high school, college sports, and things like that. When they come, to the clinic, and they're with their parents or whatever the case, it's like, no, everything's fine, everything's fine. But then you do a test, and it shows that they're really not fine. They have all these other issues, underlying issues. And what is the big problem with concussions is it's something called second impact syndrome. So when you get a concussion, the brain is, having some edema, it's swelling,
Mhm.
right? So it's recovering. It's going through stages of recovery. So you want to monitor and you want to make sure there's no symptoms are recurring before you put them back into play. Because if you put them into play too soon, as you saw with Tua, with Miami Dolphins quarterback, that big controversial hit when he got the first concussion, they put him back into play too soon. He managed to get a second concussion, and those concussions are worse. It's called a second impact syndrome. The brain is not yet healed. Now you have another injury on top of that, and that could be very, very life-threatening. So it's very, very important for a physician to determine when the patient's telling you the truth, when they're not telling you the truth, how to analyze those symptoms, how to catch those symptoms, and when is it appropriate for them to go back to play, or any kind of contact, even if they're not an athlete, going back to work that's dangerous. Let's say they're in construction or whatever the case is, you don't want them falling and hitting their head again. So that's probably the biggest challenge. Every concussion is different. It's a brain injury. Every brain injury is different. But I think some of the most challenging ones that I have are the younger athletes that want to play and they want to go back into playing their sport, whether it's volleyball, wrestling, or whatever the case is, hiding those symptoms and then having some setbacks and really trying to treat them through those symptoms to a point where they could go on about their normal life.
Wow, that's really challenging, especially there will be also psychological changes, of course, right? And then maybe part of the depression, they're afraid of the socialization at some point. Then you say something about photosensitivity at one point because of that concussion. But thank you so much, Dr. Alekseyev. That's amazing part of that. But how are you managing the treatment or the clinical part on your leadership, knowing that you're still managing the 40 PAM, and then as a medical director, how do you balance that? So what's your, as a leadership skill, what will mold you on that part?
Sure. I mean, the biggest thing is organization, right? It's going through your day, and I manage acute issues, right? I'm not the only one. There's a whole leadership that's involved with with the acute rehabs. But I basically help mostly with physician aspect, quality improvement, program developments, and things like that. But again, there's a whole team. It's not just me. But I think the key to doing anything when you're in leadership, as well as still seeing patients and managing those patients, is really organizing your day. How are you going to organize your day? When are you going to round? When are you going to write your notes? When are you going to have meetings and calls? How are you going to be able to adjust if you have an emergency, right? And it's just, setting up a system for you that really works. And what is efficient? What is best for the patients? What is best for you? And really find the kind of medium. I'm more of a morning person. I like to get up, get my rounds out of the way, address all the issues, then, take care of all the administrative parts, and then, write my notes, kind of, break it down little by little. And of course, throughout the day, obviously things change, new issues arise, new problems arise, and you cater to it, whether it's on a local level or, the more global level.
Yes, yes. So you really balance yourself, and then I also asked about like what's your day to day, and then what keeps you moving. So you said exercise and everything. So that will be giving us another tip for our balance and fall support group members. So what's our listeners are clinicians. We also have caregivers. For our caregivers, what will be your tips to improve their balance or prevent falls, Dr. Alexei?
So, balance and falls, especially when you're talking about Delaware has a big aging population, right? So so a lot of people come here to retire. So balance and falls is a big problem with them. The key that I always say is, one is remember, where you are in your life, right? So, if you're 65, you're not acting like you were when you were 30 years old, right? So, the body gets weaker, the body, starts to age. And what you have to do is you have to accommodate those deficits. So one is mobility. You have to be active. You have to keep active because, as we know, each day that we are not active and we're not getting out of bed, we're actually losing muscle mass. It's a fact, right? So that is why a lot of these individuals who end up in a hospital and they stay there for 5 to 7 days, maybe longer sometimes, get very debilitated. And why is the individual who was walking independently all of a sudden cannot walk? So that's a problem we face all the time. So one is mobility, and you have to stay active because you're managing through a lot of, your day to day, but it takes more energy expenditure, right? The second thing, like I mentioned, remember, what age you're functioning at. So if you need an assisted device or, taking your time with the things you're doing, for example, getting out of bed, so, don't just jump up. Maybe you have orthostatic hypotension, or maybe you have, some dizziness from, something else that occurred. Just take your time, sit up, collect your thoughts, gather your thoughts. If you need an assistive device, grab an assistive device and take your time. For elderly individuals, eliminate clutter in your house because, tripping over things like rugs and, different things, that are in our way, can cause a lot of these falls. And you might get away, might get lucky a couple of times, but then the one time you do fall and you get a brain bleed, it's not going to be a good situation. It's really going to set you back. So taking your time, staying active, and also eating right, I think is very, very important because if you're not eating right, you're also not feeling right, right? So balance and exercise, diet and exercise goes hand in hand. One doesn't work without the other.
Yeah, I totally believe with that. And us as a clinician, physiatry in PM&R, and also physical therapists, we educate them well that they are coming failure to thrive as their diagnosis. And then, of course, they will fall. And then in the department, they are not eating. I said, how can you get those nutrition and tolerate those 3 hours of therapy, right? So we really need to educate holistically. Thank you so much. For our listeners who are clinicians, I know I can see that you're very disciplined, you're very organized, but as clinicians who are looking forward to have more leadership skills or wanted to learn more about their niche in the entrepreneur part or something, what will be your tip, Dr. Alekseyev? You're a good
So
leader. Amazing. Congratulations.
So, to find your niche, you really have to see what works, what doesn't work for you. When I first started out practicing, sports was a big thing for me. I love working with athletes, and I became a team doctor for the hockey team, and it's great. But then, what works for you? Do you want to start a clinic that you're passionate about, but does that clinic tie into what the community needs, right? It's looking at I manage a lot of the inpatient, I deal with a lot of the inpatient side mostly. So when I was establishing a clinic and I ran a brain injury clinic, stroke clinic, PM&R clinic, sports clinics. So when you're looking at these, you have to see one is, does running this clinic help the community? Is this something you want to do? Is this something that is within your realm of practice? Because if you're doing something that's not in your realm of practice, you might not be the right person for that job, right? Because a lot of people want to jump into doing something, but they're not really specialists in it. So you could actually do more harm than good. Also, you have to also have a good life and work balance.
Yeah.
You have some time for yourself, spend some time with your family. If you like, exercising, for example, I do CrossFit. CrossFit might not be for everybody, but it's something that I enjoy doing in the morning. Before, I wake up 5 in the morning, I go do a CrossFit workout, come home, shower, get ready for work, go right into work. And that starts my day, that gets me energized, right? Also, after the day, like, what do you like to do with your family? Maybe in the weekends, maybe you like to travel, take little short trips here and there. You have to have a good balance, because the biggest problem, I think, with physicians, they take on too much. They take on too much, and then by the time they realize how much they're handling, they're in this facility, they're consulting in another facility, they have patients here, they have clinic 3 times a week. It's burnout. Burnout is a very, very big thing in a clinician world. So you want to make sure that you're, not taking more than you could chew, so to speak, right? Take on how much you could handle, take it one step at a time, develop it to a point where you feel like you're successful doing it, and it's running like a fine oil machine. Like my inpatient right now, I'm at a stage where it's almost kind of self-run. I work hand in hand with the therapists, with the nurses. I know the admissions, how they work. I know how the discharges work. I know what the hospital needs, what the business sense is, what the patient sense is. So when you combine all those things together and you make it work well, then you find that you have time for other things and other ventures, like a clinic, or maybe something else, like, maybe you have passion for something else on the side. I mean, but I would say, if you have passions, don't wait on them, because the more you wait on them, the less opportunity you're going to be able to jump on them. I mean, time flies. We only have, as a physician, maybe 20, 25 years of really good practice. So during that time, you really want to establish yourself, and you really want to make an impact on what you're doing in the community, and hopefully you could drive that needle a little bit.
Yeah, I like that word, making an impact. You really make a trademark for your patients, that they remember you, right? Yeah, that's really important. Thank you so much, Dr. Alexeyev. I learned a lot from you. We learned a lot from you, of course, our listeners too. So how can we connect with you?
So you could reach out. I'm in Dover, PAM. So you could either give us a call there, and they'll connect me right to my office, or you could just send me an email. It's K.I. Alekseyev, my last name. So KIALEKSEYEV at pamhealth.com. And shoot me an email if you have a question, if you have a concern, if you're not sure which way to go. Reach out to me. I'm happy to assist, happy to help at any time.
Yes, yes. Thank you so much. And I remember, Dr. Alex, if you have still a brain injury support group or something there, or how does it work? Because we have Parkinson's disease. I know we treat stroke injury, of course, brain injury. What else are the services we have, specialization there?
So, I mean, we take on all kinds of conditions, right? Any
Yes.
kind of conditions, we take on Parkinson's, ALS, we take on brain injuries, stroke, of course, is the majority of the things,
Yes.
like post orthopedic conditions, post shoulder, knees, hips, whatever the case is. A lot of trauma, because you'd be surprised over the summer, especially. There's a lot of beachgoers. So you get a lot of motor vehicle trauma, multi trauma coming in. But we also get a lot of cardiac, pulmonary. We get a lot of cancer that we coordinate, and we get them better for pre and post chemo treatments to keep them strong and healthy. And we also basically have the general debility, somebody that's just been in the hospital for too long and they need a little bit of a tune-up, so to speak. We handle all kinds of conditions, all kinds of angles, and we do have the BIAD, as Brain Injury Association of Delaware, meet facility, and we have the support groups, and we certainly help them from that angle as well.
Thank you. So that's very helpful. So guys, check out your area if you have those acute rehab. We are all over. And then also we are based in Delaware. It's just lucky enough that Dr. Alexeyev is also here, but I usually interviewed everywhere. So thank you so much, Dr. Alexeyev, for all this really amazing tips for us. And then congratulations on your practice and of course your leadership. We really appreciate you. So guys, if you have any questions, connect with us. I will put Dr. Alexeyev emails and information. If you want him in person, he's in Palm Dover. All right. So connect with us, and thank you so much for watching. And if you want to have your caregivers or you're part of the family, connect with us in Balance and Fall support group as well. All right. Thank you and bye for now, guys.